Hi, I'm Dr. Mark Student, and thank you to ChiroSecure for enabling me to share with you some incredible information and putting together this platform. I am deeply indebted to them, and I just love sharing. Today's going to be an interesting topic, and we're going to go to our only slide right now, and we're going to talk about the why versus the what. Listen, I've been in the game 44 years, and the why is important versus the what. We've been so entrenched in what to do. We need to adjust someone. Where do we adjust? And how do we adjust? And what do we do? What do we do? What do we do? What do we do? Well, what I always heard growing up in chiropractic is the biggest difference between chiropractic and medicine is they'll spend 99 cents on diagnostics and 1 cent on treatment, where we spend 99 cents on treatment and 1 cent on diagnostics. Well, guess what? We're both wrong, because we don't want to wait till something gets to be diseased to treat it or in pain to treat it. We want to prevent it from breaking. But more important, what are we treating? And that's unfortunate in our profession. Let me rephrase that. The why are we treating it, and what's wrong with what's going on with the tissue? And specifically, what tissue are we treating and why? And when I ask that question, what are you treating and why? 99.9% of the chiropractors in the nation are clueless. And knowing the difference is the arbiter, and this is the subtitle, of being an expert or a mid-level provider. And I go through this when I deal with orthopedists, neurologists, neurosurgeons, pain management doctors. I go through this all the time. You guys get people well, but you know what? You miss so much. And you don't really know why you do what you do. You just know that it works. So you focus on what you do, which is why too many doctors talk about their technique and no one really cares about that. They don't care. Oh, I adjust the patient. They don't care. You get them better? Why? Growing up in chiropractic, it's been, well, what's wrong with the person? There's bone on the nerve. Why? I don't know. It just is. Repetitive micro movements, car accidents, sport. Why? What tissue? Give me the why behind it physiologically. Well, there's bone on nerve at the nerve root. Well, we all know that's wrong. It's been proven so many times as evidence in the literature. And interestingly enough, back in the late 70s and early 80s and even 90s, we never knew anything other than bone on nerve at the root. Well, it doesn't happen that way. It's actually bone on nerve at the facet level. But here's why that's important. Because when there's bone on nerve at the facet level, and this is what you need to know about the why, okay? The joint capsule, and I've spoken in this forum about this previously, the joint capsule separates, and there's a meniscoid, which you can see on MRI, that separates the facets. That meniscoid dislodges, and the bones approximate. The facets do this, and on the facets are nociceptors, and when that meniscoid comes out, the joint capsule, which is ligament, starts to elongate or crimp. So therefore, you have your nociceptors, your proprioceptors, your Golgi tendon apparatus, and all of those things. We're going to go back to the slide for a second. We're going to keep us saying the slide. You have the nociceptors all feeding into the lateral horn. When they feed into the lateral horn, it spills over to the piezo ion channels, and it goes from the mechanoreceptors into the proprioceptors, which are your deep paraspinal muscles. It then goes back through the piezo ion channels into the spinal thalamic tract, up to the periaqueductal gray area, through the thalamus, hits the brain at disparate areas, the motor cortex, the prefrontal cortex, the cingulate cortex, the anterior cingulate cortex. It just ping-pongs around in the brain. Then it goes efferently back to the thalamus, and then it goes to different areas of the body disparately, so you can have pain, cervical, thoracic, if you have a lumbar problem, because the body's going to want to create biomechanical homeostasis. Can you explain that? You have to. That's the why. And when I'm with I was with a medical primary care provider, and he explained to me that he gets a minimum of 25 cases a week that have back problems. He sends them to PT. And I explained to him that based upon the evidence in the literature, that 90% of physical therapy patients, with back pain, with spinal problems, if PT is the first provider, opiates go up by 80%, disability goes up by 313%. He goes, why? I explained it's very easy. You've got a meniscoid, etc. And I explained that to him. I said, are you bored yet? He said, I don't understand a damn thing you just said. But I know that you know what you're doing. And you are, because remember, where does the majority of the world think we are? They think we're somewhere below a physical therapist and somewhere above a massage therapist. You don't have to like it. That's the truth. There's a reason why there's such a tremendous shortage of physical therapists, because all the MDs are referring to them. So he said to me, oh my God, I can't believe that you know it to that level. And I said, would you like me to show it to you on an X-ray digitizing biomechanical model, or do you want to see it on an MRI and I could show you the meniscoid and I could give you the evidence and the research? I could quote chapter and verse of the research. He goes, no, I don't need to know any of that. He says, where do I send my patients to you? I said, I don't have an office. So I got someone, I trained him. He gets now on average 25, sometimes 20, sometimes 30 new cases a week sent to him. Can't keep up with it. Can't keep up with it. He's selective. But this goes on all around the country when we're dealing with surgeons. I have Dr. Don Capaferi down in Georgia. God, I can never remember the name of the place he's at. Not in Peachtree Corners, Georgia. His number one referral is an orthopedic extremity surgeon for shoulders. He tells his patient, you got a shoulder problem, but there's also most definitely a cervical problem. I want you to go to Dr. Don Capaferi. He is the best spine diagnostician I've ever worked with in my career. And he says, and he's a chiropractor. You want me to send me from an orthopedic surgeon to chiropractor? Yep, he's the best. I have Dr. Dallas Humble in West Monroe, Louisiana. He's got a neurosurgeon he works with every day. The neurosurgeon for spine won't see the patient unless Dr. Humble screens him first. Is there a lesion which is surgical or injectable or not? And if it is, he sends him over with a biomechanical workup and a piece of technology called Zimverta. If it's not surgical or injectable, you keep him. Well, less than 1% go to the surgeon. I don't know. All I know, he's doubled his practice in a short amount of time. I could go all around the country. It works just like that. When you know the why behind what you are doing, you are no longer considered a mid-level. You're a peer. And mid-levels are actually eroding the fabric of our healthcare in this country because they're becoming the expert because there's not enough people who are experts. I can't begin to tell you how many calls I get from surgeons, from medical primaries, from pain management doctors, even from lawyers. Please take my case. Please work with me. Please open an office. I had someone call me yesterday they were in New Jersey. They were 6 hours from where I am. I can't take that patient. I'm not going to court. The guy wouldn't let me hang up. I'll pay you anything to help me and spend 2 hours on the phone with me. I gave him 30 minutes and gave him what I needed. So I have another attorney, that's states away that's hiring me. I go through this all the time. And so do our other doctors because it's about the why. And you need the credentials behind you. So all the credentials we give you are also through medical academia. You're co-credentialed because you get validation of what we're doing that you know the why. Now, if you want to know a little bit more about the why, just take a picture of that QR code. That's our next primary spine care symposium, which is coming up in a few weeks. Join us. We teach you the why. You've got to stop taking, let me rephrase that. Take all the courses you need to take to help you get better at your craft and become a better clinician. But you have to start getting credentialed in answers, in learning the diagnostics, in learning the why, in understanding the difference between a varix and an extruded disc, understanding what an ependymoma is and a schwannoma. So when you look at the images, you understand that. So you can educate the other providers. And more importantly, there is a 43.6% error rate, close to 50%, of general radiologists interpreting spine. You're exposed to that. You're delivering a high velocity thrust into your spine on almost a 50% error rate. No. It almost cost me my license because I abdicated my diagnosis to a radiologist, a neurologist, and a neurosurgeon. I don't want you to have to go through the 11-year battle I went through. Thankfully, I never lost my license. It came close. We never abdicate. We learn. You've got to understand the why of the what you're doing. That is it's the only way up. And in the words again of Dr. Capoferri, who I work with regularly, he said, the more I learn, the busier I get. Dr. Tim Weir in Raleigh, North Carolina. He's one of our fellows in primary spine care. He said, the more credentials I got, not only the busier I got, all they want is me, just me to diagnose the patient and move on. Tim right now averages between 50 and 70 new patients a month. He does only personal injury, and he turns away 20 cases. He doesn't like the lawyer. I mean, I could go all around the country, whether it's New York, whether it's Massachusetts, Colorado, California, Seattle. The more the people learn the why of the what, you rise. It's like putting more water in the bucket. Everything rises with it. So the message for today is to learn the why of what you do. If you have a question, you feel free to call me anytime you want. Just Google me. My cell phone number is out there. Thank you so much for spending a few minutes with me today. Again, ChiroSecure, I cannot begin to thank you all enough. I am so happy to be able to do this and work with you. Folks, have a great day.